Have you ever wondered what the difference is between a penis pump and a vacuum erection device? Are they the same thing? Is one medical and one not? Can they both help with erectile dysfunction? And if you're buying it online, how do you know what you're actually getting? This is something we get asked all the time at Restorative Health Clinic because the terms used can be really confusing. Some websites call them penis pumps, some call them vacuum erection devices, some call them VEDs, and then there are hydro pumps, manual pumps, battery operated pumps, sex toy pumps, medical pumps, rings, sleeves, cylinders, and all sorts of accessories. So in this video, I'm going to explain the difference between a penis pump and a vacuum erection device, what each one is used for, and what you need to know before you buy one. I'm Melissa Hadley Barrett from Restorative Health Clinic, and we help men every day with erectile dysfunction, prostate cancer recovery, and men's sexual health concerns. So let's start with the simple answer. A penis pump and a vacuum erection device work in a similar way. Both use suction around the penis. That suction creates negative pressure, and the negative pressure helps draw the blood into the erectile tissue of the penis. As blood moves into the penis becomes larger and firmer. So from a basic mechanical point of view, they are very similar, but the difference is usually the purpose, the safety features, the design, the quality, and whether the device is being used medically or recreationally. A vacuum erection device, or a VED, is usually the term used in healthcare. When we say VED, we are usually talking about a device designed to help with erectile dysfunction or penile rehabilitation. A medical style VED usually has three main parts: a cylinder that goes over the top of the penis, a pump that removes air from the cylinder and creates suction, and a constriction ring, like this, that's placed at the base of the penis to help maintain the erection for intercourse. The pump helps draw the blood into the penis, and the ring keeps the blood there. That is why a VED can be useful for men who can get some blood flow into the penis but not enough for a useful erection, or cannot maintain an erection long enough for penetration. It can also be useful for men whose nerves are not working properly, such as after prostate cancer surgery or other pelvic surgeries, spinal injuries, or diabetes. One of the really important benefits of a VED is that it does not rely on the same nerve response as a natural erection. So even when the nerves are recovering or not working well, a VED can still help create an erection. And because finding a proper medical grade device online can be tricky and confusing, we've actually pre-selected the safest, clinically proven medical pumps in our Restorative Health Clinic shop online, which I'll link in the description below. But to understand why quality matters, let's look at how the rest of the market uses these terms. Now, a penis pump is a broad term. The words penis pump are often used by the general public, online shops, adult stores, and marketing websites. Some of these are proper medical vacuum erection devices, but many are not. Depending on where you look, they can be designed for anything from erectile dysfunction treatment to recreational sexual play. You also see them marketed for size increases, or even making bold, unrealistic claims about permanently adding to your length or girth. And this is where men can get confused, because two devices might both be called penis pumps, but one may be designed as a medical erectile dysfunction device, while the other may be designed as a novelty product. That does not mean non-medical pumps are automatically bad, but it does mean you need to know what you're buying and why you're buying it. If your main issue is erectile dysfunction, then you need to think differently than someone who's buying a pump for experimentation. If you are recovering after prostate cancer treatment, penile surgery, pelvic surgery of any kind, or an illness that has affected your erections, you need a device and a plan for rehabilitation. If you want to use the device for intercourse, you need to understand the role of the constriction ring. And if you're buying a pump because someone has promised it will make you permanently bigger, then we need to pause there. A pump can temporarily make the penis look larger because it draws blood and fluid into the penis, but that does not mean it permanently increases the penis size. In some men, particularly after prostate cancer surgery, a VED may help preserve the penile length as part of a rehabilitation program, and it may assist in returning some of your penile size if you have experienced a loss in size following an illness. But that is very different from saying a pump will permanently enlarge a normal penis, so please be careful of big, bold claims. If a product promises a guaranteed permanent length or girth increase, I would be very cautious. Now let's look at what makes a medical style VED different. The first big thing is pressure control. A good VED should allow controlled suction. Too much suction is not better, Too much suction can cause pain, bruising, swelling, numbness and injury. You want gentle, controlled pressure. You also want a quick release mechanism, and if something feels wrong, pinches, pulls or becomes painful, you need to be able to release that vacuum quickly. The second difference is the ring system. For erectile dysfunction, the constriction ring is often part of the device. The ring sits at the base of the penis after the erection is created. Its job is to reduce the blood flow, leaving the penis too quickly. But ring size does matter. If the ring's too loose, the erection may go down quickly. If it's too tight, it can be painful and unsafe. This is one of the biggest issues that men have when learning how to use a VED. It can take time and practice to find the right ring, and that's really normal. The third difference is fit. The cylinder needs to suit your body. If it's too wide, it can be hard to get a good seal. If it's too narrow, it can be uncomfortable. A good seal is very important because the device needs to create suction. Most men need to use a lubricant, a water-based one, around the base of the penis and the cylinder to help create that seal. And men also find that manscaping or trimming your pubic hair helps a lot. The fourth difference is support and instructions. This matters more than people realise. A lot of men buy a pump, open the box, see all these bits and pieces and feel overwhelmed. They try it once, have a bad experience and then put it in a drawer forever. That does not always mean that the pump didn't work. Sometimes it just means that no one explained how to use it properly. There is a learning curve. Using a VED can feel awkward at first. There's a clear learning curve, meaning you'll likely need to practice, try different ring sizes, adjust the amount of lubricant, or simply slow down your pumping technique. It usually takes using it a few times before the whole process starts to feel natural. So when you're choosing a device, support is really important. Instructions are important, clinical guidance is important, especially if you're using it for erectile dysfunction, penile rehabilitation, Peyronie's disease, or after prostate cancer treatment. Now let's talk about how these devices are generally used. This is general information only, and you should always follow the instructions that come with your own device or are provided by your own clinician. Usually, you place a water-based lubricant around the base of the penis and at the opening of the cylinder. The cylinder is placed over the penis and held firmly against your body. Then suction is created slowly. And I want to emphasise the word slowly. Do not rush. You are not trying to pump as hard and fast as possible. You create a little suction, pause, allow for the penis to respond, and then continue gradually. For many men, this process takes several minutes. If the device is being used for intercourse, once the penis is firm enough, the constriction ring is removed from the cylinder and onto the base of the penis. Then the vacuum is released and the cylinder is removed. Just remember, the ring should never be left on for more than 30 minutes. That is very important. Leaving a constriction ring on too long can reduce blood flow and cause injury. So if you're using a ring, set a timer if you need to. Do not use a constriction ring if you're intoxicated, very sleepy, or likely to forget that it's there. Now, do both penis pumps and VEDs help with erectile dysfunction? Potentially yes, but again, it depends on what you mean by a penis pump. A proper vacuum erection device can be helpful for erectile dysfunction. A proper vacuum erection device can be a game changer for this problem. It allows men to create an erection completely without tablets, making an excellent option for those who can't take ED medication when pills aren't effective, or as a vital part of your recovery for prostate cancer treatment or other pelvic surgeries. They are also an integral part of a broader penile rehabilitation program. However, a cheap novelty pump that has no pressure control, poor instructions, poor fit, or no appropriate ring system may not give you the same result, and it may be less safe. So rather than asking, should I get a penis pump or a VED? The better question is, what is my goal? Are you using it just for intercourse or a specific rehab protocol? And finally, if you're using it purely because you think it's going to make you bigger, please be careful. Temporary swelling is not the same as permanent growth. The evidence for permanent enlargement from pumps is limited. Now let's go through some of the common myths. Myth number 1, a penis pump and a VED are completely different. Not necessarily. They use the same basic principle of a vacuum pressure. The difference is usually the quality, the purpose, the safety features, and whether it's designed for medical use. Myth number 2, more suction means better results. No, more suction can just mean more injury. You want controlled suction, not aggressive suction. Myth number 3, if it hurts, it is working. No, pain is not the goal. If it hurts, stop, release the pressure and reassess. Myth number 4, a pump will permanently enlarge your penis. Not usually. A pump may create temporary enlargement. In some rehabilitation settings, it may help preserve the penile length, but it should not be sold or as guaranteed permanent enlargement device. Myth number 5. If a pump does not work the first time, it will never work. Not true. Most men need practice. There is a learning curve. The first attempt is often not the best attempt. Now, who should be careful with these devices? If you're on blood thinners or have a bleeding disorder, you may bruise more easily. If you had significant penile pain, skin problems, severe curvature or recent surgery, you absolutely need to get medical advice first. You also need to take extra care if you have reduced sensation in the area, simply because you might not feel pain or pressure properly before damage occurs. If you use any pump and develop significant pain, bruising, numbness, swelling or skin injury, stop using it immediately and seek advice. So what's the bottom line? A penis pump is the common everyday term. A vacuum erection device, or VED, is the term we use clinically. They both work using suction to draw blood into the penis, but a medical style VED is usually designed for erectile dysfunction, penile rehabilitation, for safe and proper use. A general penis pump may or may not have those features. So before you buy, be clear about what your goal is. Whether you're trying to get an erection for intercourse, recovering from prostate cancer, managing Peyronie's disease, or finding that tablets are either ineffective, unsafe for you, or you have bad side effects. The right device depends entirely on that goal. And if you're simply chasing size claims that might not be realistic, it's time to hit pause. The right device depends on the right goal. At Restorative Health Clinic, we help men work out whether a VED is suitable, how it fits into their erectile dysfunction or rehab plan, and how to use it safely. We also have a clinically selected penis pumps and vacuum erection devices available through our online shop. So if you know what you need, you can have a look there. And if you're still not sure, book a telehealth appointment with our team first. It's much better to choose the right device at the start than to buy the wrong one. Hurt yourself or end up with something that just sits unused in your drawer. I'll put the links below to the online shop and the appointment booking link. And if you already have a pump and you're not sure whether you're using it correctly, watch the video on common penis pump mistakes next. Thanks for watching, and remember, erectile dysfunction is common and help is available, and you do not have to figure this out on your own.